sometimes as we get together to learn from each other. So I don't know if many of you know of Black Creek, but here we are. We serve this community, which we call Northwest Toronto. We're part of the Northwest Toronto Ontario Health Team, really because everything is about the Ontario Health Teams now, and funded by Ontario Health and Toronto Region. And I put our one pager of our last annual report on the table, just to highlight the importance of data. You'll see a lot of numbers on the one side of the paper here, and it's so important for us to remember that collecting data, it's important not only for accountability to our funders, but it's accountability to the communities that we serve. It's to ensure that we're doing the right things for the people that we are entrusted and funded to serve. So when we collect data, we're collecting things perhaps that maybe our funders may not care about. They care about numbers, certainly to match the dollars that were funded, but we need to know who we're serving. What are their barriers and challenges? As a community health center, in Canada, community health centers were developed over 50 years ago to really serve the most vulnerable, folks with barriers. Folks who don't have a lot of barriers, I would say I put myself in that category because I speak English, I understand the Canadian healthcare system, and I can bulldoze my way to ensure that I get the care I need and I deserve. But there are many people, especially in our community that we serve, that don't speak English as their first language. They're newcomers to the country. Their socioeconomic status is such that, they may not be able to take time off work to attend an appointment. So we have to come up with strategies to ensure that we engage those folks, to ensure that they get the care that they need and they deserve. And sometimes they need a helping hand. So the data that we collect around, language in our community, race, because we know that impacts our health as well, especially some folks from certain demographic groups, they've had historical barriers, and we learned that really well during the pandemic. We saw who was most impacted. And again, that was a time where we advocated to collect data because we knew that we had to make a case for the resources to come to the communities like ours who needed the care more. And sometimes it's a struggle. It's, we have to have evidence, so we have to collect the data. We just can't go to folks and say, we need more money, because we need to say, because X number of people in this community have high blood pressure, have diabetes, are lower socioeconomic status. So we need to collect the data. And as you might hear from some of the staff here, especially those that work with the community programs, it's challenging. It's challenging to collect data from certain population groups because of mistrust. So it is a burden. And to the title of this session, from burden to clarity, we have to figure out how do we overcome those burdens? How do we help our service recipients give us the information, share the information in a respectful way so that they know that we're not collecting their information to do them more harm, which is what they think sometimes. We're collecting it so that we can ensure that we do better for them. So this workshop, I believe I support it, and I know that the Susanna has been working here at Black Creek with us to help us understand that the importance of collecting our data, ensuring that the diverse programs and services that we have, somehow we can figure out how to have a much more integrated way of collecting the data to share those stories and to bring clarity to the work and the services that we provide. Because at the end of the day, this is how we continue to get more and more resources to support the community. But I know how burdensome it can be. And any tools or any strategies that you can all share today, I hope will help each of you actually to collect that data better and to tell your story better. Just to make the lives of those that we serve better. Okay, I think that's all I have to say. I just wish you a happy day. There are folks that work here that will help you with any housekeeping details. There's some coffee and water and things in the room next door. Washrooms are out there. Just make yourselves at home for the time that you're here and have a great workshop.
Thank you. So we're gonna do speed bingo. It's gonna be 5 minutes. It's a way for us to talk to each other, interact. It's 5 questions, and I'll tell you what they are. One, has the person dealt with any challenging patient? Work in a different role than you. So you're meeting the person and you're getting their name. Has a go-to stress relief habit. Has been in the healthcare system over 5 years. Can share a quick communication tip. So it's gonna be very fast. It's 5 minutes and you just have to, you're gonna move. We're gonna exercise today. All right, so I'm just gonna move it out for you. We're gonna have some lively music from the Music Man.
We hope.
And if you haven't had a chance to express yourself, we have some little emojis. Does everybody want to do it?
So is it at your own table or you have to move around? Oh. Oh.
So I have the,
What organization?
I have my timekeeper is gonna tell me when the 5 minutes starts, but it means that you have to move around, so anybody that you can reach within 5 minutes, get their name and ask them that question. When timer starts,
Sometimes you have to.
Do you have one?
Yes. Okay. Go to
How are you? How you doing? I want to know. So you're in a different role than I am at Black Creek. Oh, okay. Thank you so much.
Never boring, that's for sure.
Oh, I know.
Okay, I don't know, I started and then I would just share it.
Do I hear 30 seconds?
Last chance.
Last chance.
Have a quick communication tip for me?
Hi. Hi. All right, that's it. All right, everybody back to your seats. So we have 3 people that are in this seat. All right, how was that?
Great.
Don't scream at once. How was that? I saw some faces, some people looked really happy, and I love that. So I'm gonna call on one person to share. What did you learn from someone that has a stress relief habit? Handa.
Oh.
I don't see any emotions on you, so I picked on you.
No worries. So this person said that they have chats with their friends. For the stress relief.
Oh, stress relief.
Mhm.
Does that work for a lot of us? It works, right? Yeah, we've had it a lot of times. All right, so tell me about someone that has been in healthcare for over 5 years. Tell me about that person that you met. And I'm looking for someone that has not. Oh, you didn't get to meet anyone. Alvin.
I didn't meet anyone.
Oh my goodness, I'm sorry.
You
Who
just
here
came
wants
in.
to
Yeah.
share from this table? Constant.
Sure, did you call my name or did you just say half my name? You were
I
thinking
feel like you wanted to say something, and I.
Really?
You're welcome to start.
Somebody's been out here for 5 years, you said?
Yeah.
I don't
Did you
think
meet that person?
No, I actually didn't get that one. I'm
Okay, tell us about one interesting person you met in the room today, and
not
what was it that you learned?
Well, I mean, I met Gita up in Durham, so that's a pretty good track.
Yeah.
She's a data analyst, and I guess it aligns well with the work that you guys are doing today, so that's what
Fantastic. And I want someone from this table.
Those questions out?
Works in a different role from you. You met somebody today that works in a different role from you.
Well, I actually went to my esteemed colleagues and quickly got that answer there.
Give me people you already knew?
Yes.
Come on. That was not.
Oh,
Fair.
Okay, so I'm gonna pick on you then again. Share a quick communication tip that you learned from someone else, not yours.
use as very few words as possible.
To communicate?
Yes, that was from Mel.
You thought it was effective?
Brittany.
So they're going with feelings, emotions.
Yeah, Brittany said he uses very few words.
Do you think that? You wanna talk about that?
No, because I didn't say that.
See, it goes right back to
No, hey,
communication.
Priscilla said it.
You said
What I mean is, at least in my sector, when people send emails that are very long, a lot of information.
Oh, so that's a
So
different
talk about
thing.
being concise. When I say use a few words, it's also be concise, get straight to the point,
Perfect.
but
Bright
then
and
be clear.
brief.
Yeah.
That's what you meant.
That's what.
That's what you meant.
Priscilla said.
We want to have a translator in here. All right, so that was good, and I'm glad that you guys got to meet each other. I'm just going to get into the meat of the matter. I'm just going to tell you a little bit about Dr. Sue. Before she comes, I'm going to tell you a little bit about her. All right, so Sue started her love for healthcare in South Africa. There she volunteered with an NGO whose mission it was to take care of orphans and vulnerable children impacted by HIV/AIDS. At this time, she offered training and coaching to the executive director. Looking back, her passion for system strengthening was being forged. She really saw a need to strengthen the system. And that led her to start her second master's in HIV/AIDS management at Stellenbosch University. Okay. Her love for strengthening systems continued in Jamaica. She was born in Jamaica, where she was appointed Director of Monitoring and Evaluation of the National HIV/STI Program. She was responsible for reporting on these national health priorities while supporting regional evaluation assessment in Belize and Trinidad and Tobago. This work continued in New York City, where she led her agency to achieve federal recognition for reporting and being awarded federal grants. Suzanne was featured in the marquee Who's Who in 2024. So knowing the disparities in women accessing PrEP, which is pre-exposure prophylactics treatment, she undertook her doctorate research in that area and worked in supporting citywide initiatives towards women and the LGBTQ prevention efforts. She obtained her doctorate in health and behavioral studies from Columbia University. Since then, she has expanded her work into chronic conditions and continuing quality improvement. I'm over 40 and my eyesight, I'm telling you. But I want you all to get it. Designing national projects and systems resulting in lasting change for many communities. A core tenet of her work is removing health inequities and supporting healthcare teams see improved measurable results for the health and well-being for the communities in which they serve. And she is passionate about it. And I was talking to you and I heard you had so much, and I just felt so excited about what you were telling me, and just knowing her and how she has experienced that. I think we're gonna have a really, really great time here today. So I'm just gonna turn over to her and I talked about it. I'm done. All right.
Thanks everyone. Thank you so much for being here. I'm checking my card and I didn't bingo. So who bingoed? Who got all 5?
Ooh.
Danny?
Yeah.
Oh, woo! So you get a prize and you get a prize. Thank you so much.
Go Oprah. Go Oprah.
Go Oprah. Yeah, that's me. Not a card.
It's not a car.
All right, so I'm so happy that you're all here today. I'm very grateful to Black Creek and all that they have done to make this day possible. Who knew putting on a free workshop was so costly? I didn't. But thankfully, Black Creek stepped in. I also want to extend my gratitude to you, because without you, we would not be here to talk about data and strengthening reporting and the program flow. I also want to extend deep appreciation to my co-facilitators, Melanie and Tracy. They have paused their work to be here to support us and to just make the whole package come together. Just really want to acknowledge them. They're also their own business persons running their own operations. I really extend great gratitude to you. And of course, my family, a village, it takes a village, right? And my husband is here and my mom is in the back and she was helping with setup. So it takes everybody to make it possible. So give them a round of applause. Okay, so, all right, so this is, let us look at this, right? So I know when we talk about data, there's so much pressure and anxiety around, I'm not a data analyst, I'm not into analytics. There's just so much anxiety, fear, confusion, and we hide, right, from it. But today, if you collect data, if you collect information about your program, if you go to meetings and you have to report about what you're doing, your stories, your impact, you are in the right place, okay? So I just want to confirm that. So it's a tight morning. It's now 10:10, so we're making good time. And before 12, we are going to go through shared language, which are a few concepts that we have. We're going to look at some challenges. We have post-its on your table. We have flip chart paper, post-it sheets. So we have enough writing material. You also have your workbooks. We're going to be looking at the program pathway, and we're going to touch on the logic model and a new formula that I've coined. We're going to do a demo of a platform that was created because of the need to analyze data more efficiently and in a timely manner. And then we're going to go into reflection. So we're going to pack all of that in less than 2 hours. Are you with me?
Yes.
All right. Okay, so let us get into the meat of the matter. So who will start us off? What brave soul is going to tell her, not a definition, but your context. How do you use data? How does data show up in your context? Did Mel say this is an interactive session?
I did it.
So could we note down some of the responses for me? Yes,
I
Bridget.
guess our data is directly connected to money for programming, money for funding. The current expectations, I guess, of getting anything, I feel like is solely tied to data.
Mhm. Thank you. Anyone else? Data in your context. You can give me a definition, or you can just tell me how you use data in your context. I don't want to pick on my usual suspects.
I guess also too, like the second part of that, but I think about it is like our data is what we're trying to use to also prove that services matter. So like give a little context, like Parkdale Queen West is recently, in the last year had received many cuts to harm reduction based services as is going kind of across the sector. So we're really trying to use data to show that.
Yeah, establish need, context. Yeah, great. You see it?
You could also like use data to, I guess, what's the word I'm looking for? Like prove like the importance of a program or prove like the need for something. Like in the context of like the Blood Creek area, there's a lot of people who have higher diabetes, rates, stuff like that. So, and we see that through our data on the reports that we pull, and we can use that as, I guess, a means of proving that they need more programs pertaining to like that chronic condition.
Okay, wonderful. Increasing. Okay, so basically a lot of proof of concept is coming through. We know data helps to drive the direction of money. Come on. Eve?
Information that helps us do reality checks. So like data about our clients can include like sociodemographic data or even just basic things like the number of clients, or there can also be qualitative data. Like data isn't always just numbers or percentages, but we can give people surveys about like, how do you feel coming to this group program? And that also counts as data, getting to be like 70% of people really feel supported by this program.
Yeah, awesome. Durham, the Durham group, let me hear from you around data. Any other thoughts?
It could also be like a source of truth almost, like we might think that we're doing something very well, but if we're actually looking at data and looking at the numbers, then we're seeing that we are. It'll actually tell us the truth about what's going on.
Thank you, that's awesome. Good insight. All right, let us look at measure. When we talk about measure, how does that show up in your context? Do we work with measurements, measures? Do we know what measure is? All right, we're gonna look at definition. Do we anybody use measure? Any measures in your programs?
Are you
Yeah.
referring to our, what's it called? Our numbers that are.
The numbers are
Yeah,
supposed to.
yeah. The numbers that you use?
So we have to refer.
Yeah, your numbers.
Target.
Yay. Good, all right, we'll come back to that. Indicator. Do we use the word indicator? Yeah,
In reporting.
you report on indicators. Okay, wonderful. Anything else about indicators? Do you create your own indicators? All right, we'll come back to it. We'll have a quick activity. What about reporting? What about reporting? What does that look like in your context? Reporting. Everybody reports. Hi, welcome. Sorry to point you out, but your new face.
Yes.
What's your name?
My name is Faye. I'm the program manager of Bonasa and also provides mental health services for Black youth and families in Denver. So sorry about the coming in late.
No,
Nice to see everyone.
you are most welcome. We're happy to have you. Okay, how does reporting show up in your context as a
So
program
reporting,
manager?
it looks differently depending on who we report to. We have funders, the city and the province that we report our findings so that we get continuous funding, and also we have to report to our board and also community members what we've done for the year or for the quarter, and how often we the reporting as well.
Okay, awesome. Thank you so much. So there's no one stream of reporting. It's flexible. It molds and moves with the funders that we have. So quickly, these are some simple definitions that I've presented here around what the terms actually mean. And instead of me reading all of these things, I'm just gonna call on table 1, table 2, table 3, and then persons can read. Katrina, can you read what data is for me?
Raw facts and figures collected with program activities.
Okay, so with that definition, can I see a show of hands of persons who are involved in that process? I see pretend. Is it everybody? Okay, all right. What about measure? And so we're defining measure here as Mark.
Yes,
Dr. Mark.
yes,
Can you read measure for me?
you have to measure. A defined way of quantifying or tracking what matters.
Okay, so who in the room is seated here? Like you are tracking and quantifying. I heard about numbers and source of truth. Those concepts, are they where you're seated? Are you part of this process? Yeah? Any clarification that we need to make here with measure? What about measure and outputs? Are we seeing the difference? Are we seeing some similarities? Anyone could tell me what an output is? Although it's not here, just throwing it in because I think we may also use that term as well. Output. We're gonna come to logic model soon. But when we look at that program pathway, we know that the output is connected to your activities, right? And that's one of your ways that you show the theory of change, right? The things that you're doing in terms of your activities, whether you are on a mobile unit today, there are some activities that you need to do, and therefore some outputs that are attached to those activities, right? To show your team, your leaders, your stakeholders from this activity, this was my output. And then the measure is a way of tracking. So there are some similarities there, but the measure is a way of tracking, and your output directly correlates with your activities. All right, who would volunteer to read indicator for me? Table 2. Alvin.
So an indicator is a specific value that signals progress towards a goal.
What does that remind you of? An indicator. When you think about your stories and your reporting, what does that remind you of? What about your outcome? Does it remind you of outcomes? Yeah, that more distal. It's not necessarily connected to your output per se, but it really captures the essence of what you're trying to accomplish, right? And so indicators tend to they're very defined, and in how they measure your goal. And so it can be a measure, it can be a group of measurements as well, a group of measures. Any questions relating to how we are defining these core terms? Okay, so let us move into a quick activity. And I have the example here to guide you. So you're implementing a community outreach project to increase attachment to primary care. How many of us this language sounds very familiar? I know, right? Black Creek, I know Durham. What about youth services? Is similar language?
Yeah, somewhat.
Yeah, somewhat. Okay, all right. Okay, so here I have an example. So for the data, persons talked about numbers and targets. For the data, we have 25 participants, right? Attending the nutrition education session. For measure, we have the number of participants completing the session. For indicator, we have a percentage, which indicators tend towards being percentages, but they don't have to. So it's 80% of enrolled participants completing the session. And then the reporting is you're gonna report that the program reached this amount of people. So I'm gonna ask table 1, table 2, table 3 to huddle very quickly and give me another example using the overall program of a data measure and an indicator. So you're doing 2. So just there's post-its. Okay, huddle around that. Table 2, we're gonna ask you to do a measure and a reporting. And table 3, I'm gonna ask you to do a data and a reporting. So just 5 minutes. 5 minutes.
So we're doing first the number 4.
Just an example. What is there? Data what? Data and indicator.
You guys wanna do it in the context
Oh,
of
like-
diabetes?
So.
Exactly what happened today. How many people here today?
So that's for.
Perfect. Yeah, hold on.
And then how many people are gonna walk out saying, I don't do the program?
What are we presenting?
Right.
Makes sense, yeah.
For diabetes. What are we?
Time check.
All right.
5 minutes.
Look at us, done and done.
Table 1 is done.
I don't need to
On
think
table
about
1,
it.
you're using all the
So you got to the number 2.
You're using diabetes. So what are we?
So you have data and indicator.
Yeah.
Okay.
I'm doing
Yeah.
it. One. Yeah.
The screening, like
The screening, like the cannabis program.
so you get 18 people.
And our indicator like that.
But we know who walked in.
Yeah, we don't know yet. We're gonna see who completes it. We'll check it at 12:30.
It looks like 100%.
Yeah, yeah, I don't think we'll be able to. There's always that one. You, me, yeah.
This is a little bit different.
Let me hear what your indicator is.
We have 18 minutes group.
Yeah.
Which one takes out there?
What's your indicator?
Who stays to the end? How many of that 18 are gonna stay?
So you have to give me you state the percentage.
We said, we said,
100%.
yeah, we said 100.
Well, that's fine. If that is your, so you know that you easily not meet that. So if you don't make 100, you would have fallen off your target. So if you want to, so is it
What the
realistic?
funder wanted was.
You tell us.
Realistic, it's short.
Yeah, it's a short.
Go ahead, be honest.
Yeah, but then they're right.
If you wanna add in like a little short, you guys have so far.
You have an A?
And who is reporting, who is gonna like, share for everyone?
I can't see.
I'm marking for your art.
But see again, in the data, the larger the group is more, you don't have as much control.
Yeah.
Or with 18, there's a fair amount of control.
Yeah.
Data, right?
But if we have,
No, you'll notice if everybody's right?
if we had 100 or 200 people,
Yeah, that's
we
harder
would
to
know,
manage.
you would know.
Yeah.
So I'm on the Herd Hub, and yes, they want, the Herd Hub obviously is like a big program.
16 divided by 18 is
Very,
89%.
That's right, 90%.
If you have people leave, we're at 89.
Don't provide money for guidance, no, there's like, good luck, go ahead,
People
and,
leave,
oh,
we're
right,
at
but actually, there's someone wanted, have you been tracking? It was 6 months, and nobody was part of it.
If we do 85%, we have wiggle room for up to
Right
3
now,
people.
Yeah.
it's very specific.
Okay.
And it was very.
85.
That's wild, yes.
Yeah, one or two.
I'm so sorry, yeah.
Is this all about reporting to get funding?
And considering also.
I mean, it could be, yeah, you could do reporting, not just for funding, you can do it about performance.
Performance.
Well, like, not with
Yeah.
funders, like within teams, or how programs are.
Are you getting through to the board? That's basically
Yeah.
No, not actually, like.
This
Yeah.
health is all new, fairly new to me.
Oh, okay.
Right.
Like, most programs.
So in our role, really, we were, yeah, reporting the, like, what working and outreach.
It will get better though. I
So
don't
what
really
we do, because we kind of monitor this program, the amount of people attending and the amount of money that we're spending, and if it, like, just think for example, we use our reporting within our team on a micro level, and then we have our bigger reporting.
Yeah, with the funders.
So, what kind of indicators do you create to evaluate the efficacy of programs that you start?
Like attendance is first and foremost.
All
I think, yeah, I think now we're doing most of it's like.
And they can
And
change.
your program is here?
Yeah.
Blackberry.
That's the
What is typically like good attendance
I don't know.
for, like what, because obviously it's not.
You see +5,
Yeah.
at least like 5 participants. That are coming consistently to programming. Otherwise, it's just a waste of resources. Maybe that's something that's showing that this is not a need, right? And then you can reassess and figure out what is.
And just specify we can connect with them one-on-one.
One-on-one.
Or that individual having
Yeah.
Okay, so thank you so much for engaging in that activity. So I'm gonna just start with table 3. You guys, they seem to be having a lot of conversation there. So table 3, you had data and reporting. Can you just share what your mission, what your numbers look like?
So we kind of just like used examples, but then we mostly got on conversation about like the high requirements of reporting and the difficulty of clarity
Sure.
of what's required and kind of just the different ways a little bit that we all have to report.
Okay, all right. We got, you know what? You're leading us into the next activity. So we're gonna look at challenges. So share some of the examples that you guys use for what a data piece would look like, and our.
So we use like an example, like a diabetes group, like a wellness, like a exercise diabetes group. So the data is like 12, or I can't remember how many. So 12 people attend for 12 weeks.
Mhm.
And so we said the measures like would be, of course, how many people were coming, what the expectation was. So the expectation from the funder was 8 people attending. Because so like obviously we were victorious and over that number because it's a perfect world. And then we just talked about, kind of like the expectation on reporting. So like it would be like, okay, did those 12 people attend every session? Was there any barriers in the way of them attending? Potentially doing like a survey with the participants, and then also like the follow-up pieces. So they're coming to this program for a reason, so they need maybe extra care with their health issues. So are they connected to a provider? Like what's the follow-up after the group is over? And then also like, so including that in like the reporting pieces as well, for not only like the funders' knowledge, but our knowledge about like how we can, adapt and grow with our groups, and also just for the participants' well-being to make sure, they're connected to the service.
Wonderful, thank you. Give table 3 a clap, please. Awesome. Continue in reverse order. Table 2, measure and reporting.
So table 2 kind of did diabetes screening as well. So
Yeah, someone said diabetes, and now
we yield to their response. We think it's thorough.
There we go.
We'll take that, it's fine. We're gonna circle back. Okay, table 1.
So we actually use this presentation as our example. And our data was that there are 18 people here today. And our indicator was if 85% of people stayed, we would be victorious. And we think it would be it's a reasonable indicator because a smaller group, and it's not that long of a session.
Okay, thank you so much. So table 3 raised a point that I want us to like just give a little bit of thought to. Funders' priorities versus our priorities. So with the diabetes example, I just use that as it's like 2 tables circled around diabetes. So for diabetes, your funder gave you these parameters, right? They wanted the 20 persons to be a part of this diabetes education program. You hit the number, you achieved your indicator, and we're all doing well with that, right? But what about the community and your priorities? How do you build that in before you implement the group? How are we building in the priorities of our communities? When I say communities, I'm talking about ourselves because we are the community, we are serving our community, we are the extension of them. So how are we doing that? Can we share? To get the award notice, it tells you all the parameters, everything that you need to do. How are we going about doing it?
I thought about it. Okay, I was gonna say, like in regards to like competency, like making sure like the community that is like on the back end has like expectations and guidelines that are like set out. And then also as far as like the community, like getting like feedback and hearing from the communities that we're actually serving would also be helpful in regards to that.
Okay, thank you. So community feedback, building all the systems at the back end. Danae?
So yeah, just continuing on that, building out the systems on the back end. Before you start a program, being able to identify where you're going to promote and or access the pool of persons that you feel may be in need. I work in North York, so it's kind of easier in diabetes because we have the highest occurrences of diabetes. So the assumption is once you're in North York, you should be able to hit a couple numbers. But the other thing that you have to consider in building this out is access. Like, are they going to reach where you are, or are you going to them? And nobody talks about that in the reporting element, right? The funder doesn't care how you got the 25 people there. Are you setting up mobile, or are you, trying to find incentivized ways of getting them to attend, like, transportation or tokens or food or whatever. Like, those things aren't a part of the data.
Okay. Table 3. Priscilla.
We don't do diabetes.
Not for youth, right?
Just want to be very clear for mental health. I think a lot of what has been said already would be what the approaches that we would take. Surveying existing clients, checking in with other stakeholders in the community, other organizations that we have partnerships with, in terms of what they're seeing or the need. And then using that to tailor our approach, but then also checking in throughout the process, so that if we need to make any adjustments moving forward to ensure the success of the program, we're able to do that.
I think too, also checking into what we have done, and so I think what has worked in the past, what has not worked in the past, is likely not the first time this program's taking place or something similar. So what our successes were in that and where we struggled. I know when we get the data indicators and whatnot, it's also how we translate that to the staff. So what does that look like for them realistically? And also the practical operational pieces. So do we have the coverage for the whole 12 weeks? Do the staff understand what the indicators are, what the goals are? What does the program planning look like? Can we plan this in advance and figure out just to be more organized about it? Because all of that I feel leads to a more successful group and more participants and more concrete data.
Wonderful, thank you. So these are things that we hope that we are going to be able to bring in a little later on. As it relates to building out the systems, right? When we get an award letter and it tells you the indicators or the various measures that this program is gonna you're gonna report on. How many of us, and I don't need you to literally show your hands, but just to think, how many of us are also capturing the other measures, like the measures that the funder may not have as a priority? Are we capturing those measures? Are we telling those stories as well? Are we creating a bigger story, or are we thinking about what is required of me? I need to meet my measures. I need to get this done. I need to be acknowledged. We want to do well. We want to get more funding. And so that's just, I want to just leave that for food for thought. And then let us just jump into the burdens. Okay. Brittany mentioned it in terms of the challenges in reporting. So we have a paper there. So what I'm gonna ask folks to do is one Post-it sheet per thought. So if you have multiple thoughts, you can use multiple Post-it notes. So you can just grab a few for yourselves. And then I want us to talk about what feels most difficult. When you think about your programs, we all have different programs working with mental health, working with diabetes, chronic conditions. What part of the process feels most difficult? And you can also turn into your workbooks. Oh, and I should have said that, right? The definitions, you can go back later, but or you can maybe create your own definition in your workbook. You have your space for you to write in your definitions for the 4 core terms. We are now at page 4. Okay, we're at page 4. but you can while multitask, writing your workbooks, but also on your post-its. What is most difficult? Where is the burden? I know working in several community health centers and even at the government level, data collection is always an issue. Data cleaning, the completeness of data, those are always an issue. And if your data isn't clean, your analysis can be off. So even before we get into the analysis of it and communicating our results, we may be communicating results that are incomplete, maybe not even reflecting the community that we actually serve, because from the get-go, our data collection instruments or processes were not complete. All right, so we are asking, where is the burden, and then what feels most familiar, right? There are many challenges that we hear repeated over and over again. You could put some of those down. I'm gonna ask you to, if it's not too much of a hassle, to put the post-its there, but before you put them on, you could just maybe announce what it is that you're putting on the post-it sheets.
Just in regards to the data measures and the indicators that we were talking about before, the little exercise that we did, think of those, and maybe we can just put that slide back up, as you're asking yourselves these questions, because the questions are in your workbook too.
Yes.
And I think it's helpful because we went through this exercise already. So when you're talking about data, indicators, measure, reporting, your first question is, what part feels most difficult and to manage?
Yeah.
And then if you can write those down on your post-its, again, think of these 4 pieces here, where's the burden?
Yeah.
That might be a little.
Thank you. Yep, this is great. This is good. All right. Amanda, your post-it is finished, so you can tell. What do you have for the first, or what is your first thought going down?
I think the reporting is something we struggle with.
Reporting?
Yeah,
What
just
aspect?
like having the time, because sometimes we see like clients back to back to back. So we don't have necessarily the time to do that, and then catching up, and then there's deadlines. So I think that's a burden for sure.
All right, wonderful. Can you put that up?
Yep.
Morgan, what are you feeling, thinking?
It's kind of an overall theme of just a collection of data overall, because if the staff or the people that are working with the clients don't believe in the importance of data, they're not going to be doing their due diligence. And then if I'm more so thinking of like a client feedback survey of like how to get the client voice to influence our services. And that's one thing that we struggle with, is getting clients to actually respond to those surveys, because they're like, why am I going to bother doing this? It's not going to go anywhere.
Yeah.
So it's kind of from the top down approach. It's like, well, if staff don't believe in the importance of doing it, then why would their clients do it?
Yeah.
So that's kind of a burden that I was thinking about. Kind of all of those.
Yeah, yeah. So while others are writing, I think we could maybe unpack that a bit. I think sometimes we believe that our brilliant ideas for programs, like the staff buy-in is like automatic, like it's gonna be sure. And I remember being in Jamaica, and we have like global fund reports and reports into international bodies, but you are collecting from 28 different parts of the island, like different service sites and so forth. Some, the collection is seamless, others not so great, others non-existent, and then you now have to like try to unpack that. So I think we have to make sure that we are selling the juice to ourselves, like we have to sell it. So, and I think maybe that's something that we're also not taught in terms of how do you get buy-in. We think about buy-in from leadership, right? Because they need to sign the checks, sign off on the processes and all of those things. We need the resources. but we actually need to get buy-in from the lowest level of service delivery. Like, we don't spend enough time, I think, making sure that we are all working towards the same goal. I was in a training once and the facilitator said, I don't remember the company, but it was a high performer. And I don't know if it was an anecdote or a true story, but a funder visited and they stopped because someone was cleaning, and they asked the person something about the overall program. And the person who was cleaning actually responded to make the link by what they were doing to that bigger goal. Like, we need to make sure that the person who is wiping the floor understand that the wiping of the floor actually lead to your community being in better health, lower diabetes conditions. Like, but we sometimes we operate in silos and disjointed approaches. And so when it is now that the collective effort is required, it's then so difficult to put those pieces together. So I think one of the things that I have learned early is not that, it's easy to do. Of course, it's difficult. That's why we're all like struggling. We have to get buy-in at the lowest service level early, before implementation. I think when we're talking about building out the system, when we're talking about collecting community voices, are we collecting staff voices? Are we asking staff if they're comfortable? What are they uncomfortable with as it relates to the programs? Because we get it and we're like, this is good. And it is. Because as Denny is saying, North York, the highest levels of diabetes, you can find them here. So it's good that you get the funding to do it. But is it good that your team members are not buying into that overall vision? And then how do we pause to make sure that as we're building out the systems, they are part of that conversation? All right, let me get off that high box. All right. Okay, so back to the question in terms of any other post-its going up? Dita?
One issue that we see is the data quality.
Data quality?
When the service providers, when they input the encounter,
Mhm.
they do not complete everything which is required for us to report on.
Mhm.
So that creates a gap. That is one major issue that we face.
Yeah. That is like definitely a common.
You're not the only one.
Yeah, that sounds familiar. It does sound familiar. Any other? Remind me of your name?
Yes. Oh, Vara.
Vara.
Yes, we're from the same Durham CC, so I put down the same thing, data quality. But I think also maybe another would be, I guess, not like a complete understanding of workflow or maybe process, because like the providers could be inputting things in one way, but since work teams can be like siloed and we don't really have an understanding of
Yes.
how they're inputting that information. So that when it comes time to pull that data, there could be a bit of disconnect sometimes.
Any other, who shares that frustration? Yeah? Okay, Black Creek type, Denny, yeah.
So I wanted to talk about that a little bit, the collection piece, or the entry point of your data. For us, it's in the EMR, all our clinicians are working with the EMR. And I feel like there are places in the EMR where data goes to die.
Yeah.
Or hide,
Yes.
or something, and I only find out, and I wish, maybe this is an indictment on me, but I wish I could catch it before the reporting. Every time we get to the reporting, I'm like, that sounds off. Anecdotally, that doesn't sound accurate. Why isn't it there? And so we have to go through this process again, where we, in staff meetings, remind people that, this is where you're, supposed to put this data. And, and also ourselves, as the person's doing reporting, we have to, we're almost double checking the work. Like, we know where you're supposed to put it, but we also know what the outcome is supposed to be because we know the clinic flows and so on. So that is definitely a burden, especially on the back end for like myself and the person to do reporting. The other thing that I'm now a little bit perplexed about is where does data go when it's not for a report?
Right?
Where there's no burden on you to be accountable to a funder,
Right.
but there is important information being collected. So for instance, we run different types of programs at our clinic, and a part that's built in is that you will do surveys. Like it's qualitatively, how did this program work for you? Did you get what you thought you were supposed to get from it? But that collection of that data is not tied to any specific report that we do. So does that then inform the quality of that program the next time around that we do it? Or does it just go into the air? So I'm more and more concerned about that as we implement new things in my clinic.
Yes.
I'm private sector, so perhaps there's a wolf in the middle of the sheet here. That'd be nice. But
Welcome, Wolf.
So we tend to focus on the data component of what we do, take the data from what you guys do and do some processing on it. We're actually doing some research right now with a healthcare institution and some academics, and what we discovered is that you guys may think your data is objective, reality is not. And that leads to an adoption friction for what you're trying to utilize that data. And I think it's something for you to take a look at. When we do analysis on a lot of institutions' data, most of them don't even know how bad their data is, and they wonder why they get bad results. So clarity, demystifying that is a key piece. And that, I think, I don't remember what your name was, but you mentioned this a bit, about that leads to adoption friction. If you don't trust your data, you don't want to use it, so you don't want, because you know what it's supposed to be. You may not be able to quantify it, but you know what it is, because you've done it before.
Can I ask a question? Is that a systems issue or a user issue?
It's a bit of both. We discovered it's a bit of both. Because you have data always end up the process, and people are the kink in that process.
Right.
But the fact is, there are a lot of systemic issues in the data. You talk about EMR, we work with a few of those. And you're right, if you don't train people properly, and eventually after you train them, what happens? They begin to slack off.
No, really good points, and it goes back, as we talked earlier about that friction, tension with the funder requires these, but you know that you're also collecting these because it helps your community, right? So I think, wouldn't it be great if we are able to create a reporting template that it covers both what the funder wants, what is needed in our community. So there's no piece that is lagged behind because it all gets used. But I think we build our systems around funders and not around community. And so when you do that, you are basically handicapped because you lean heavy towards one side because that's where the funds are flowing from. But in terms of the whole, we wonder, maybe they don't want this information. So it goes into a dead space, as was said. And also the EMRs, oh my gosh, the EMRs, and they're obviously great, but they are a source of pain and frustration. You're reporting, you're cleaning, you're training at the same time. You're trying to make sense of what is in the EMR, trying to, based on your hunch or anecdotal information, you're trying to call and trying to clean it at the same time to make sure that the report is trustworthy. If you don't really trust where your EMR is taking you, then you tend to only maybe just say, okay, here, funder. But the fulsome use of it, you don't really use because you really, inherently don't trust it. And so we have to find a way to build training, ongoing training in our QI processes. Everybody has a QI team. Functional QI team. That's ongoing and making sure that these updates are taking place. Building on each quarter's reporting. So you see the issues here, you build out a training program, you implement it so that the next quarter you're even better in terms of your data is something that we can trust. Can I just pause to have all the Post-its placed on the sheet, please? While that, and if you need help, just raise your hand and we can just take those from you, put up. All right, so I think we are paused. Time check.
10:55.
Okay. So, all right, so we're gonna go into the broader program and looking at the bigger picture. We have a large activity in your workbook for this section, so I want to give you as much time as possible. All right, so the logic model, we're talking about inputs, activities, outputs, outcomes. We're not gonna really stay there, but we're gonna look at the inputs, activities, outputs.
Yeah.
So we know that we all struggle with data in one way or another. There is no one area in which we struggle. It's right across the board. Some of us are stronger than others in some components of it. But there's always some type of burden that we need to address, and how do we build towards addressing those without necessarily addressing them directly. So we're going to look at the larger program models that we're using, and also a suggestion that I'm proposing forward. Okay, so quick show of hands. Who have used the logic model, heard of the logic model, been a part of the process? Show of hands. Durham, do you use it? The logic model in your programming. Do you know? You're okay. All right, that's fine. Brittany, yes and yes? Yeah? All right, okay, good. So we have most persons, are you aware of it in school? Anything? Okay, in school. Okay, wonderful. All right. So tell me how it works in your context. Black Creek, you use it.
Yeah.
How does it work?
So if you're interested in running a program, you would create a logic model. So you would say, put all of that information in, include a budget as well, submit it, and then if it's approved, you can go ahead and do that. What we've implemented recently is that if there's no, if you see that there isn't like a high attendance, then maybe that's not a program that you should continue on with.
Okay.
And then you can figure out ways to like restructure it.
Okay.
Yeah.
Okay, so I'm hearing that you are ready to start a program, you do a logic model.
Right.
Okay, great. And you have a budget attached to it, and
that's based on your area of focus, whatever your.
Sure. Any other, how do we use a logic model? How do you use a logic model in your context? Similar?
Yeah.
Okay, all right, great. All right, so we use it to basically get a program started, right? Okay. After you have gotten your program started, how does it help you?
It guides your, like the budget guides the money that you spend. It guides, you have your goals in terms of participation. You're also gonna have like your activities, so your planning.
Yeah.
Would be done according to that as well.
Okay, so you do your planning, your budget, okay. the whole theory of change, how does it help you in your day-to-day?
Everything's organized in one place.
It's organized on the shelf?
No,
On
no,
your
in the
computer?
logic mod, on the computer.
Yeah.
If you print it, it can be on your
Yeah.
wall.
Okay.
So it can, like, it helps with the planning, but
Helps
it
with the
also
planning.
helps us evaluate programs, if we are on the right track in terms of outcomes, short or long-term outcomes. So we can look at it to see if we are on the right track to achieve those goals or targets.
Okay,
And it includes an evaluation process.
Yeah.
We have to be.
okay, so at the start and the end of your programs, the logic model, that theory of change helps you at the start and at the end. So at the middle, there are some seeming gaps, like how do you use this? How does it inform your day-to-day? Any other thoughts around the logic model? Yes.
So I'll say this much, most programs, if we're honest, follow some kind of logic model.
Right.
The challenge comes in like the accountability piece, right? So when you get into the middle of it, are you holding yourself accountable just to the model or to where the program is taking you, or the direction that the participation that you're seeing, the types that are coming through whatever that program is, does that shift anything, or do you hold firmly to that? And I think one of the reasons why like smaller orgs like mine haven't really named it that we're using this is because of that piece, right? Like this happens in highly funded orgs where everything has to be reported and has to be accounted for in a funder way, but not necessarily in an underground way. So obviously, ideally, you want to get to the place where you have a solid model that you can drop in any scenario, really.
Right.
But there is that middle ground where you could get sidetracked, and do you choose to, right?
Yeah.
Just wondering how we address that issue, right? Because it does happen. It's for us, we have at like halfway point through the program, kind of do like a check-in to see how things are going and if there needs to be any sort of pivots. So
right.
Yeah.
And so what you have done is you have seen where there are some gaps and you just you make sure that you fill them.
Yeah, because
So-
when you're starting to plan it, it doesn't necessarily mean it's going to go accordingly, right? Like you can have an idea for a plan and then the participants tell you that they want to move in a completely different direction, right?
Right.
So
And I think some of the challenges have been like in the past, management can't do it all. So recently we've added extra health promoters. So now we actually have people who are able to kind of support in that monitoring at the monitoring level, Kanda. So she's able to really kind of be on it and connect with the staff one-on-one to kind of review the programming as it's going and support in any way that's necessary. So I think, like you said, if it's a smaller organization, you don't have the resources to kind of support in that way, but it's important because I think it will improve our data quality and our outputs.
So I mean, you have basically, so this high level theory of change, you have done it and then you have seen where you needed to like put in extra supports to make sure that it works, right? So that's exactly what leads us into what gets missed from the logic model. So depending solely on the logic model, it does create gaps. One of the things that is important when you're creating your program is defining your program, like anchoring your program in your data, in the community's data. What is the big why? Why are you doing this? You're not doing it because you think it's a good thing. You're doing it because the data shows or the evidence shows, or based on the various projects that you have implemented, you have done assessments and this is what is coming to the fore, right? It's the cream rising to the top. So we need to make sure that the logic model is not complete. So we need to make sure that we are clearly defining what success means. Now, remember the logic model, as we just saw, the outputs, a lot of us stay at the outputs because it's the results, it's the immediate results from the activities. But if the logic model only focused on the funder and the funder's requirements and not the whole requirements, then you're actually not very clear. Your program isn't defining success in the truest form. So we want to make sure that from this the goal getting stage or the planning stage, we are making sure that we are wide in how we are defining our program. And that leads to missing measures, right? Because if at the end of the program you say, oh, it would have been good to have collected their A1C at the start of the program to show the change that happens at the end of the program. So we have to know what success looks like, and that's what is driving our measures, not just our activities as in the logic frame or the logic model. Ownership, accountability, we're going to talk about that. Who owns it in terms of where the data tasks, the revision, as Danielle said, and also because sometimes we're in a smaller organization, there's multiple roles that persons are carrying. So being mindful of all of that, right? In saying that, whose responsibility is it to check in after month 1 that persons are entering, the providers are entering in the right places in the EMR? You know, who is doing that? Is that something that should be done based on your past experiences, right? Equity, equity is not really built into these frameworks, and it's not built into the logic model. So we have to make sure equity is a very strong outcome for us in our communities. So we have to make sure that it lives in that theory of change that we're utilizing. And then we talk about review. Is there anything, as we talked about, you know, what is missing? Is there anything that you'd want to add? Is there anything that you'd want to add? Okay. All right. So what's missing? But let us look at what strong systems should include, right? And while you look at that slide, I want to also talk about how strong systems make us feel. So we feel more supported in our work. We are less anxious. We are more clear in our day-to-day activities, and we are able to support each other. We understand the connecting links, right? So we're not disjointed. The workflow of the full program is understandable. So it makes us feel as though we are more in control of what we're doing. So I think sometimes when we utilize these big theories, sometimes we forget to look at the small things. Like I've seen logic models, and it's really well done. But at the end, I have to assume a few things. I have to assume the rationale behind it because I'm not seeing the evidence, right? So you have to make sure that you are clear on your purpose. We talked about the roles being defined. Equity needs to be visible. We need to be disaggregated our data. And I know it is I'm not sure from whence it came that racialized data is a bad thing. I mean, you know, I open myself to be schooled, but what I do know is that we use any and everything for bad. We can. just look around us in the world today. Anything can be just like flipped on the other side, and you're like, how did they get there? But what I do know is that, as Brittany said at the get-go, for us to show need, we have to show evidence. And we have to be creative, and Cheryl spoke to it as well. Our community has been abused for a very long time. And we are part of a system that has facilitated that abuse. I'm not saying you abuse anyone, but we are a part of a system that has abused our people, right? And we have many different race and ethnicity in the room, and all of our people at one point or another been disenfranchised. And knowing those historical truths, we have to now forge a path that supports our communities, but also support the help that they need. And that one of the primary ways is through evidence. I think it's someone from Durham said something about, I wrote it down, source of truth, right? We have to make sure that we are telling the truth, sharing our stories, and making our communities conditions, issues, successes, because those are assets as well. We have to make them visible. We have to be organized. We talked about data a lot, and actionable reporting. We have to also see how Danae spoke about it in terms of the other data, those non-funder data. Where do they go? And those non-funded data are actually like rich sources of storytelling, of truth, and we need to make sure that we are able to create action, advocacy. I know some of our organizations are heavy on advocacy. Those should be feeding the narrative, the social media campaigns, the interactions with community. So we need to be pulling on some of those as well.
I wanted to add to that, it also might, that all that data that might not be funder specific, but it could be addressing a gap, right, that they need to look into. So
absolutely.
Yeah, so it's good to have that as well.
Yeah, like to prove like, hey,
Yeah.
we actually need money for this too, because
Yeah.
and here's the numbers for the gap.
Yeah.
Yeah.
I would actually argue that it is funder specific, so heads up, I'm a fundraiser, so. It is funder specific because it's not output, but it's impact. So information that you're collecting from the individuals who are using the services and programs, and you're telling their story back to the funder who's funding the program, that is impact. You're showing where their money is going and how it's impacting them. So it's really an important piece that often gets missed. As a fundraiser, it's like level 10 for me. Because it's very easy to connect with folks in the community. The services that you're providing and you're speaking to these individuals, they're open to share their stories. Those stories are really important to go back to the resources.
I have a question, maybe, and this is absolutely unrelated, and I'm happy to parking lot it, but do you have any suggestions or do you have any thoughts on how to get sometimes frontline staff engaged and excited about data collection? I just feel like it can be a challenge because like, obviously a lot of folks got into this work for like the people, like the connection with people and like helping and like people are helpers and like love to do the programming, but like I find a huge challenge in like even when explaining, hey, this is how it helps and this is what it does to get them to make it a priority or see like the priority of it, I guess is kind of my personal question.
Can you add?
I was one of those people. I dreaded it because it's like I said earlier, it would pile up. And then I moved to right. And then I moved to a different role and saw the importance of it and how the numbers do reflect. And then it's like, well, this like your job it like is based off of the money that we're receiving. So if you're not putting in that information, they can come around and say, we don't need a team of 10, we need a team of 2 because the data reflects that, right?
Yeah.
So we would just do things for the end of the quarter, as long as we got it in for the end of the quarter. But then if they pull the numbers at any time, then, and it's not reflecting, then it's like, it doesn't really justify why you're even there. So kind of reframing it that way has definitely motivated folks to get the data in when they
So
need to.
promotion, but then there was a gap
Yeah.
from, okay.
Yeah, I still have a bit of a challenge with reframing for persons that are not immediately involved in the work. So like my frontline persons, whenever we implement something, they hear more work. That's the first thing they hear.
Yeah.
And I have some that are very vocal that will tell me, oh, so you're giving me more work. And so there is a dance that you end up having to do that is not necessarily going to be relevant to them, to be honest. Like they're trying to pay their bills. If you're in community, anything, it's let's pay. So, it's already a burden on them to be showing up for you in these dynamic ways when it's easier to be non-dynamic and it's easier to not engage with all of this stuff that you need to do for your funder. I don't want to take ownership of that. So I think, there's definitely a dance that you have to do. I don't know that everybody has it perfected throughout any organizations. And I think those are the kind of stories we should be sharing, organization across the board, organization to organization, is how do you get, back to your anecdote, how do you get the cleaner to know that, making sure that people don't slip is a part of the bigger picture.
It's true. I feel like, yeah, you're right. It's a dance, and I'm not trying to it's like, how close, I'm not trying to make you I don't want you to lose sleep at night to be like, you're going to lose your job. I don't want to, but I also just feel like with the current landscape, things are scarier than ever. And I'm just I don't know how else to tell you, this is super important and critical. And you need the time, I'll give you the time. You need a computer, you can use my computer. I don't care. We'll make it work, what your needs are, but I'm just yeah.
Yes, I see.
I don't know how I could motivate providers to do that, but to be honest, what I was thinking of is just optimization and workflow optimization.
Yes.
EMR.
Yes.
I think oftentimes it kind of comes down to this is too much work, or I don't have enough time with the person, the client or patient that I'm seeing. So there are ways to kind of work around that within the EMR. Maybe putting, for an example, for fall risk or something like that. There's ways to have that pop up depending on the clients and demographics or this and the other.
Yeah.
So I think it's just making the work easier for the provider or making it more streamlined.
Yeah.
I think will help.
I was gonna use that word, thank you. Yes,
I think it's important to have people know that they're heard. Not just that we hear what they're saying, but that it has some kind of value in terms of a shift and implementation that you do. So I'm going through this right now, so that's why it's fresh in my mind, is, in meetings, I'm the queen of overt but subliminal. So I'm not gonna tell you that your job is in danger, but I will impress upon you in other ways how this plays out. But also, I get feedback from my team and I allow for them to be as open as possible with me, separate from the larger group. My frontline people, I listen and I'm like, okay, you just made a very good suggestion. I'm going to do this, this, and this to make things a little bit easier for you. In fact, the EMR that we went with was because of my frontline team. I wanted to give them back some time in their day because they felt encumbered by, the monotonous tasks that they were doing. So it's having them feel like they influence as well, how things are shifting, because sometimes they do have very valuable feedback, that we're missing.
Yeah. Any thoughts? Yes?
I have
Please.
Can I ask a question? When you deployed your EMR, and you said you wanted to give time back to your workforce, did it actually happen?
Yes.
So how much time were you able to measure? How much time?
I'm not able to measure, but anecdotally, I can say that they easily got hours back in their day.
What do you want?
So we're using Acura,
Yeah.
and it was just, it's less heavily dependent on the secretary.
Yeah.
To do certain things, like everything is embedded in there for the provider to just click through and complete. So the secretary's work is really on the front end, data collection, making sure, pharmacy's info is in, whoever's info is in already. And so the provider just clicks through. And I sat with demos of different EMRs and I'm like, okay, you're gonna have, let's use this to give me around data processing because of how this EMR works, right?
So we keep hearing, my impression was, we keep hearing about the work, additional work. And we deploy technology sometimes in hospitals and into the department. And when the doctors define these tools, the first thing they ask about is cognitive load. They got their day, they know what they're gonna do in that work, and if I add something that adds 3 seconds or 10 seconds in the work, it's not gonna work, because I'm not finding that patients in a day, over a week, this keeps happening.
Yeah.
So if there's a tool, because all of you guys have kind of for the most part mentioned that these reports that you have to input 3 times, you just push it off and off and off. If there's a tool that could reduce the cognitive load, would that increase the adoption of those different tools so together with that?
Oh, I'm sure it would, especially for the provider end, because my EMR took care of my entry level ones. But on the provider end, it takes us 3 to 6 months for providers to feel comfortable with a new element of the EMR. So we have a way now to collect data we thought was brilliant, and we made sure that it was one extra sheet. So we put every checkbox possible, but it's one sheet. You're not doing two sheets, and it's just checkboxes, and our checkboxes will feed the data on the back end. And even with that simplicity of collecting the data, it took 3 to 6 months for adoption for our providers, because they really don't want additional burden, right? So it's important in giving people tools for data to think about, like, how much thought do they have to put into this? And that's why, we really sat with it and was like, it has to be a checklist. It cannot be something they have to read and interpret too long, because it's gonna take away, and they're gonna not wanna do it properly and so on and so on.
So when you add in that checklist, it's pretty dense. What about the issue of transparency that data has to go through as well? But now there's a bit of a black box in how connection between the people you put into the data and what happens after that.
Yeah, so for us, we had extensive conversations about what every line meant, right? It's just that we're abbreviating it now for your checklist, right? So, and we continually have, refreshers because we'll onboard new staff that has to deal with it.
All right, thank you so much. All right, so I just want to wrap this section with just adding to what Yassine and Tracy said. So in answering Brittany, one, I see that a lot of funders are not necessarily giving space for a narrative. So they will just ask for you to upload just your data. But I think to Tracy's point, you have to push back. Push back meaning you send that extra email to flag these impact areas that are not necessarily reflected there. So we have a responsibility to carry forth what we are seeing as program success and program stories to the funders. So we need to do that. And to Yassine's point and Danae's in terms of streamlining, how many of us, when you look at your EMR, see data that you have never used? Do you collect data that you don't use? Anybody? Yeah? We tend to over collect data and under report what we have, right? So we need to make sure that when we're looking to add more data points, that we are streamlining the full system. So if we don't need to collect it, don't collect it. until you need to collect it. Because sometimes I think we collect more, so much more than we use. Okay, so I want to introduce this formula to you. It's called the P formula. We talk about pathway, and actually, if you know about process mapping, it's really this in parts. It's understanding the large program that you're creating, and then creating process or pathway steps towards achieving it. And so that includes that clear definition, your evidence behind why you're doing it, all of that. Then the E is evidence plus equity. So we need to make sure that equity is included in our evidence and therefore build out in our measures. So that's also very important as we define what success is. And then accountability, Danae used that word earlier. Who is responsible? Who is tracking the reporting findings? How you're creating those stories? Those types of folks. And I know at the different size organizations, we might be doing, one person might be doing all of those, or it might be in different departments. So I wanted to introduce it to you. It's in your, it's what, page 6. And then this is how I have paired it with the logic model. So it's not adding additional work. It's just creating that broader framework so that when you're ready to define success, you actually can. And so we have the pathway, the evidence and equity, and the clarifying of the accountability components. And those fall under outputs. The pathway is where we start. So we're not starting at resources or input. We're starting at pathways. And then everything else flows from there. Any questions? Just being respectful of time, so I'm just pushing it a little faster. Okay, now I am going to do a demo of a platform, if I can. So it's an AI-powered platform, and this platform is called Data to Report. It's in beta testing right now, and it is trying to the aim is to address the gap of report analysis. So you have your data, and I think it was Katrina or no, Hamda mentioned that she has the data, but she doesn't have the time to write the report. So you have the data, and you need to write a report. Now, it helps with reducing your burden. It saves you time and energy and frustration. It helps with the equity visibility. And so I just wanted to do this very, so it carries you to this page. Okay, did I hear trust?
Yeah.
Yes, okay, wonderful. And I know AI and healthcare and all of that, and Constantine, you can talk to him afterwards, he has all of the information. But it is built on OpenAI. It is one of the larger models, learning models. It's not hosting your data. It is allowing you to input your data, get your report without the AI being trained or storing of your data. Of course, this is program data that we're talking about. There is no system that I'm aware of that you can be plugging in personalized data with HIPAA and what's the Canadian version? PHIPAA. So coming out of the US, that is in my mind. But PHIPAA, the regulations are trying to make sure that we cannot identify individuals in our reports, in our data presentation, right? So I just wanted to quickly show you a demo of this screen. Okay. All right, so I'm uploading a test data it's a mental health, for my mental health folks in the room, Canadian mental health data. It is covering a whole host of tables, but I want a health equity report. So this is maybe 2 days before the end of the quarter, and I'm stressed. I have all of this data that I need a report from, and I am also going to ask it to focus on tables 5 to 7 because it's a large data set. I'm also confirming that the data is de-identified. There's no personal identifiable data there. I'm confirming that again. And I want you to turn to which page is it? I'm gonna ask you to jump to page, in your workbook, page 10. That's the sample of the report that is going to pop up. So it's just taking a few moments. So now you are able to run and get a cup of coffee or a cup of tea while you wait on your report to come on your screen. The box pops up and you want to download your data, but because you are very aware of your community and the needs of your community, like only you know and no AI can fix, you will select the doc format, and then that will then allow you to read your report, edit your report, and be able to present it on the same day without the stress of putting it in Excel. Maybe if you do SPSS, I don't know, larger scale analysis of the report, you can get the report to your manager, your director, to review the report and have that on time without the stress of sitting at your desk and trying to go through the many variations of your data analysis. So this is the report. So I just wanted to spend a few moments. I want to respect our time. We don't have a lot of time. I know that you all have places and spaces to be at. So it's page 10 in your workbook, Brittany. So if it is that you want to have a demo of this platform, you can email me or send me a link to my website, and we can set up you getting access to it. Any thoughts? I have a few the sheets for folks to the survey. If you could just circulate. Oh, Eve.
Could we take a peek at the Excel spreadsheet?
Oh, yes, that's a good question. Let me open it.
Did it capture what it should have captured?
Yes, let us.
Or even just to know what the shape of the data is, like is it?
Yes. So this one I actually did it with Yassine from March. So my computer just needs a little tender loving here while it loads. So give me a moment.
Oh, what did they say?
So the data set is a little bit more complicated than your data should be, right? Should be. So maybe yours is. Just give me a moment for it to open up.
How did you generate?
So what I want you to do is, if you could just jot down a few thoughts that you have. I'm just gonna give you 5 minutes. Just jot down the thoughts, what you have seen, and what you need. it is. Let me increase it. So, well, how do I get rid of the? Okay, so tables 5 to 7. So you can see it's a large data set. It's for Canada. And so I have just asked it to zero in on, no, I wanted them to see the tables. I'll take the tabs at the bottom, you can't see because of this. Right. So tables 5 to 7. So your data set, your program data, even your agency data should be within this larger complexity, or it would be even less, which would make it even quicker for analysis and even more fuller. So, but I wanted to just use something that was a little bit more complicated. Oh, thank you. Genius. For you. My bar of genius is like
Very low.
very high, very high. Okay, so this is a data set that I used. I actually rushed through this session because I want to circle back to page page 6 and 7 of your workbook. So once you're finished, you could just, we'll connect them later, but we can just go to that activity. But any questions with regards to this AI-powered data analysis tool?
Please return this form here, right?
Oh, jeez.
Okay.
We're about to generate some data.
Right? Yeah.
Yeah, please, go ahead, Councilman.
I do have a question. So, I mean, well, first of all, how do you, assuming that everybody else is using these systems, all use a different type of system, a different schema, how do you have a transformation agent to transform their data into something that you can input into your tool to do a proper analysis?
So like if they have like string narrative data and not necessarily.
If they're all using different tools, which probably has a different schema.
Sure.
So is there a way to transform the data so that you can do analysis? And so, first of all.
They would have to download it though.
Yeah.
They would have to. Go
First,
ahead.
they have to verify that the data is in the proper format. You can get through the process with that API and stuff like that. And then you be able to process it. And then after that, you can figure out if it's usable for redistribution.
Yeah, no, really good point. So, yes, so I know some of us like use services. Do you use that EMR? You use an EMR and you also use Excel?
Yes.
Yeah? And I guess sometimes Word maybe, right? And I think most of the agencies
We also use
treat as an
Yeah,
EMR.
for- we use- so, yeah, so Treat Homey is, so we have an EMR and then it's too much.
Yeah.
There's an EMR and then for non-clinical staff, there's Treat. And then there's
Okay.
also some random Excel sheets just
Nice.
floating around.
Nice,
Yeah.
absolutely. And I
Everybody's
think,
favorite.
Black Creek is using another, you're using something for non-EMR as well?
No, but for harm reduction, they have.
Which one?
Treat.
Treat? Okay, so everybody's using Treat. Excel, I know there's some Word floating around. So what? Huh?
Side of reporting thing too.
Okay.
Yeah.
So there are many systems floating around, some more advanced than others. We would have to get them it downloaded. So it does not interact with your EMRs. So you would have to download the information, just as how you were gonna send it to your funder. So you'd have to download that into, making sure that it's clean and complete and all of the characteristics that goes with your data being presentable. So doing that and then uploading it into this database, or if you're gonna email it, or however you send. I know some of you submit your reports via portal. So whether it's a portal or it's a secured email, you would get it into that standardized format, and then you would have submitted it. It's a similar process, I want to say here. You would have to download it from your systems. If it is Word, Excel, PDF, those are acceptable formats here. So if you download it into a CSV or any type of other formats, you would still have to convert it into Excel and those types of things. I know most funders accept Excel or Word as your submission, so it shouldn't be a problem. But yeah, it doesn't speak to your EMR. It doesn't solve that problem.
Does it store any information?
No, it doesn't store the information. So you could not upload a file today and then later you try to say, okay, using that file, can you run another report for me? No, it's not gonna be storing it. So it's at point of use. All right. Are we finished with your thoughts on the survey?
Could we see the reports?
Which report?
That was generated.
It's that report. It's now fancy and in your workbooks on page 10. Of course, it doesn't look like this when it's in the Word format, but this is the report that you have.
Oh, thank you.
No problem, sorry. Okay, all right. If we could just take a minute to wrap up on that activity, please. And then, you have the email. You can send an email later tomorrow at your convenience, and we can practice it together. Okay. So at your tables, I am asking you to turn to page 7 and 6 and 7 and complete the activity on page 7 together. If we need a post-it sheet, you can raise your hand, we can give you a post-it sheet. But the idea here is you can create a new program. You can use one of your existing programs that you have. It's now the new financial year for all of us, I think. So you have programs to implement. You can now test it right here using this pathway, this program pathway, and now present it. So now you have others who can contribute to your broader idea. So I only want this, please.
Oh, sorry. I think it was running.
No. That's a highlight, that one. Okay, so we have the logic model on the bottom of your page, page 7. The input, the activities, the output, the outcomes. You can maybe give a few points right there, but I want you to focus on 1, 2, and 3. The pathway, the equity and evidence, and the accountability. As you think about your program that you want to showcase or broaden, develop, build on, please name your program at the top. And if you want to go back to page I think it was page, do I have it here? At the beginning where we spoke about, okay, this one. If you want to do a community outreach project to increase attachment to primary care, you could do that as your title. You could do diabetes, that came up as a big one. So you could look at a diabetes program that you're implementing. And so collectively, we want one sheet that you will present. And we really only have like 5 minutes for you to put that together. So agree on your title. And then you work on page 7. Any questions? Okay, so it's 11:45. So at 11:50, we're gonna just ask folks to present what they have. And then we move into a time of reflection and then lunch, we're finished.
People have questions on how to do questions?
You guys have to take the lead on this.
Can we go over this again? I'm a little confused.
You know, this is interesting for me. Because
Okay, so review one more time. Okay, so we are completing the activity on page 7. We talk a lot about what the core measures were. We talk about challenges in our systems. We talked about how we could strengthen those, right? We looked at the P formula, creating that broader pathway of understanding of our program built on evidence. And then we looked at evidence and equity, making sure equity is a key component in our programs. Then we talk about accountability. So when you think about your program now, if you have a diabetes, okay, so let us give an example. You're in North York and you want, based on the evidence, there's a high prevalence of diabetes among persons aged 40 to 75. And so you want to create a program for persons who are 40 to 55. And your evidence, and so you call it movement towards diabetes-free generation. That's my title. And then you can have the broader goal. Maybe you're anchoring it in 35% of persons aged 40 to 55 have been diagnosed with diabetes, and our program aims to reduce that number by 5%, for example. And you have your sources, then you talk about your pathway, what are the actual steps that you're going to be taking. So all of that is there. Then you're going to go into what your success looks like, and you're going to talk about evidence and equity. And then you're going to go into accountability. Maybe somebody mentioned every month or in the middle of the quarter, they do this review. They test their EMR, they pull the data, they clean the data, they address inequality issues, gaps, those types of things. You're building your program. Okay?
Thank you.
So I've just done one. Okay. All right. So 3 minutes. Clock is ticking. It
I know it's really fast. I was thinking maybe we could do this too. If you're looking at the first question, clarify the pathway.
Yes.
And the question is, what are the actual steps in service delivery or implementation? You could also look at it as to what would help to reduce burden. What would help to go back.
Oh, sorry.
Where you were?
Where
You were on the right one. No, you were on the right one.
I was there.
What would
Okay.
help to reduce burden? Think of that, to clarify the pathway. What would help to save time? That would help clarify your pathway. What would be stronger inputs, build equity, impact visibility? Those are the 5 pieces that can help your reporting to be easier. Then you start with by clarifying the pathway. So if you think about it in that terms, that might be helpful as well. And you do the same thing for evidence and equity and then accountability. it's about clarifying, right? So how are we talked about the challenges, we talked about all the burdens, how do we start to deliver them? And those are the sort of 5 areas we focus on.
Okay. Okay, who do we need next week?
What is?
So we need to create a program. Come up with a name. Then figure out.
What is that, a church?
Yeah, our one anywhere in the center.
I can check, give me a second.
Yeah, thanks.
I'm the person they usually report to.
Oh, okay. That's why I used to.
Anybody needs paper or you want to use your workbook?
Not necessarily.
Got it.
Yeah.
You're on the back end.
No, actually, this is come up.
Let's go with the senior program.
Yeah, I was gonna say, okay, so. Seniors wellness.
I'll mute it until you're ready so I can actually.
Program. Yeah.
We'll start with table one here.
Seniors and often just the invitation of there's a place for you to go.
Yeah.
Is more than enough.
Because they don't have an extra family.
Oh, sorry, yeah, no, that's okay, that's okay. We're gonna get started up here. And so, again, we're talking about what if reporting could be easier. Can you guys hear me? I don't speak very loudly. But what if reporting could be easier? That's kind of our focus here. And so our exercise is based on these 3 areas. For the sake of time, we'll sort of do one question at each table. So table number 1, if we're talking about clarifying the pathway, what are the actual steps in service delivery or implementation as we're trying to make reporting easier? What's your feedback? Or your overall sentiment is fine too.
Yeah, so we were looking specifically around like a seniors wellness program. The idea is to reduce isolation and get folks connected to programs and services. So it's just about identifying the gaps and reducing the barriers, like whether that's transportation, offering that sort of service, snacks to deal with food insecurities, and then just having them be able to connect to providers to get whatever resources they need.
Okay, anyone have anything to add? No. There was lots of really great
Yeah.
discussion, so I know it's a short period of time, but thank you. Table number 2, as we look to clarify the evidence and equity, what if reporting could be easier? What data? Sorry?
I thought we were given.
Oh, yeah, you're right, I'm sorry, table 3 has question number 2 is what I was gonna say. What data or measures show each step is happening well? So we're clarifying the evidence and the equity.
So we were talking about it at an anxiety group in the school-based setting. And one of the things that we talked about is having in-house measures that are reviewed after each program. So it's like a 4-week program, let's say. So after each program, they're reviewed and assessed, and then we can highlight like the pain points of it, the success, like the wins and the challenges, and then adopt those so that for the next cohort of groups, we can make some changes to that and hopefully then it'll just get better over time.
So it sounds like you're collecting evidence, you're reviewing it, verifying it, making it better for the next cohort. That's all in sort of the reporting, making reporting better each step of the way. Thank you. Sorry, I'm going really fast. Table number 2, question 3. We're talking about clarifying accountability. Who reviews the information, how often, and what happens next? What are your ways that reporting could be easier in this area?
As far as I guess who would be receiving the information, I guess like leadership roles, managerial positions, take the frequency of it annually or semi-annually. Also, another people who would be involved is like the data people who are actually like working with it. And then I guess what happens next is we just like assess performance and we ask ourselves if we met our goals, and if we didn't, kind of look at where we fell short and just try to get better.
So constant measuring is one of the key things we spoke about. Measuring accountability. There are people, you holding your data people to make sure you have the right people in the room. All really good responses. Was there anything else that anybody wanted to mention that we didn't talk about in this specific activity that you thought is important to mention or just to state before I pass it over to Rhonda? No? Yes.
Sorry, I was just gonna say maybe around just like what we're putting into like the AI, the privacy and stuff like that, and also just like ensuring, like not ensuring, but just like making sure that we're not becoming like fully dependent on it, and that we're using it in the context of it being a tool, and that it's supposed to be, supervised and kind of managed.
That's an important point, that it is a tool. It's not a replacement for anyone in this room at all. That's the key. Yes, sorry.
A really cool discussion that we also got into that could be implemented into this tool is using like an AI tool like Data to Report to pull up things that are really obvious to us in the room, but might not be obvious to a funder that doesn't live in our communities. Like that's like we even talked about how like establishing our seniors wellness group is going to look really, really different at a CHC like in Scarborough at Taibu or like here at Black Creek versus in neighborhoods like Markham or like just those differences that we all know intuitively like NAI tool could help write up in a report like, and this is the history of Toronto and these are.
Helps
and-
customize per
Yeah.
city, yeah, no, that's
to
good.
kind of specify that like our intervention is culturally specific to this community and like this is a barrier in this community and it's not a barrier in that community. So that's why we focus on this here and we don't focus on that there.
And
Yeah.
explaining in a way that the funders will understand. And
Absolutely.
obviously, we, like you said, it's innate to us. We think it makes sense, but obviously we might not be using the right language or the right indicators. So
We're making what's obvious to us on paper
Yeah.
and it can just, helping us, because it's hard. Like,
It
if it's like
is.
a fish in water, you're like, oh, well, like, if we have a seniors group and if you talk like this to our seniors,
Then everyone's gonna talk to them that way, which
They'll-
is not the case,
like,
yeah.
they'll show up. Like, it's not
Yeah.
a problem getting seniors through the door. Like, they're
Yeah.
some of our most active, right? But then in other communities, like senior isolation
Mhm.
and tackling that looks completely different. So
Yeah.
being able to say that in the report of like, oh, we don't need advertising budget because our seniors
Yeah.
don't, or maybe
Yeah.
we do, or but
Yeah.
being able to clarify that so that the funder can see that it all makes sense in our context, at our
Mhm.
organization.
That's great, a great point. And I do invite you all, we are going to have lunch, so some of these conversations we can continue having here. If you have to go, obviously, please take your lunch and go, but if you can stay for a little while, we're here until 12:30. Talk amongst yourselves, talk to us, talk to Dr. Suzanne, because this is her data to report. And if you have feedback specifically for her, I'm sure she would like to hear.
I just want to, before we pass over, I just want to thank everyone for just diving in and sharing. I hope that the discussions today brought some clarity, open up some mind, maybe put some question marks in some areas of what you're doing. As if Dr. Mar is breaking his neck, so let me come here. But for you to take away valuable feedback, realizing that the data pathway, how we have stratified it in our organization, isn't conducive sometimes, and we have to make the shift. We have to make sure that we're connecting everyone to the program pathway that we're on. We have to build a buy-in. To put to this point, we have to make sure that even the janitor knows why they are doing what they're doing and how it contributes to the greater goal. So thank you so much for diving in. Thank you for all that you contribute today, and we can talk afterwards. So thank you so much. And I think there's some gifts, right, Mel?
Yes, I have some gifts for some people. So we're just gonna pause a moment just to reflect on any takeaways, anything that you want to take back with you. We have a reflection going around, just a little quick reflection on what we did here today. You guys did a great job of sharing everything that has been your experience, your ideas, and I appreciate that. So I would love to hear some takeaways, some things that you think that you could bring back to your job, your work, your community.
It's not necessarily what I could bring back, but I think it was just
I'm
really
giving to
interesting that
presenters.
data
You
has all of us in
present.
different ways and like, but also in the same way. So it doesn't matter whether you're in the mental health sector or you're in healthcare or you're in whatever, or whether you're the wolf in the room. Sorry, but I think like everyone has these same challenges,
Yeah.
the same experiences, and it's just like you're not alone in this.
Yeah.
And like spaces and places like this where people can come together from all the different like areas and that's all I want to say.
No, but that's very valuable, because I think sometimes if it wasn't like a youth space or a mental health space, we feel like it's not for us. But we're actually doing very similar things. We're called upon to report, we're called upon to use data. So we can frame it in a wider, broader context that matters to each and all of our work.
For sure.
Yeah.
I mean, we can't fix it, we can't measure, so data of course is going to measure.
Yeah.
And I guess maybe you can consider your tool to be the Duolingo.
Oh, this is
data measurement.
Oh.
But, you know,
Thank you.
so one of the, one thing that we do.
Consent time is on the floor,
I'm
people.
trying to speak. Sorry, guys. One of the things that we do, is one of the services at the hospital we offer is the ability to identify bias in healthcare data sets across demographics, social determinants of health and health outcomes. And there's a use case, it started off in 2015 in Winnipeg, Manitoba, where there was a McKinsey article that said that Winnipeg was considered to be the most racist city in Canada. And you can imagine the city got really upset about that. Now, there was no objective data about it, but the community was feeling that. They were feeling it in the healthcare system, in the emergency rooms, and the indigenous and other workers, people were feeling very well. But so the city got really upset, the province got upset. But, and I'm bringing it because we brought this up. What happens when data proves what you don't expect? So when they started collecting race-based stats around there, they identified that even though the hospital system believed they were doing great care to the community, the data said otherwise. When the data came out and said that the government was providing very bad care, the data proved exactly as well. So the government, as opposed to hiding this, they said, we need to solve this. We don't want to be known as the most racist city in Canada. So they started collecting race-based statistics. So that's where it started in Canada. It still hasn't fully moved out all across Canada, but it started. And then within 10 years, the change was tangible and within the community. All of a sudden, the emergency rooms, hospitals began to report regularly what is the impact of bias variability in how they deliver care. And it's changed. Now the people actually want to provide their demographic information because they recognize that there was a change in addressing and embracing a negative stat. And so, all of a sudden, indigenous people who feel excluded, now they're providing their stats because they realize I'm getting better care. This determinant of location now became an advantage to them. And so when we start to talk about data, that kind of makes us think. And I experienced this because we do, my company does presentations to healthcare institutions, and as soon as I talk about systemic bias, right away the administrator says, if you call me biased, that's a lawsuit for me. I don't want to see it. I can put it off as long as I can. So I'm thinking, if you identify bias, then you can solve it. But even if you run the system and identify no bias in your system, well, that in itself is a measure to be proud of as well, because you can focus on things that you don't know. So this is where the data comes. It's about measuring the data, demystifying what is in that data, and then using it to make decisions as well.
Yeah, thank you for that. And I think oftentimes we get so discombobulated, we get so nervous about accountability. But our community wants accountability, and if we can show them even in small ways that the data that we're collecting from them is going to improve their lives, they will want you to collect it because they want their lives to be improved. They want health to not be a burden. And now it is a burden. So we have to show that. I think maybe in how we train our healthcare practitioner, like all of us in the room, sales, Nadine's forte, we need to now bring that up as part of what we have to sell it to our staff, we have to sell it to our community. We have to show them, use the data to show them why we care and how we're going to make a difference. We have to do that.
Any other takeaways? Anything you want to bring back with you? One great thing that stood out today? Yeah, go ahead.
Maybe not even related to today, but the idea that organizations don't do this enough.
Right.
Where we all do the shared experience conversation and realize that we're facing similar challenges and maybe can get some best practices about how to tackle that. I think that was a tangential benefit of being here today.
It was great hearing your voices, sharing all the ideas, your point of view, what you've experienced. It's been very good. So I'm going to invite you guys, if you finished filling out your reflection, please stay for lunch. It's provided for you, and thank you for being such a great bunch. Oh, so you can drop off your reflections at the sign-up desk. Behind you, you could just drop off your reflection.
I can collect some of them.
All right, you so much. Thank you.
Thank you. I'm good. I'll come back.
So, the food is self-serve, so you can make your way to the kitchen. Make your way right now.
Lunch is through that door.
If you go right over these doors, right there.
I just have to be
Yeah. No, I wasn't there this year, but I think she was there. Yeah, yeah. I'm hoping they do it. Oh, that would be great. Yeah, that would be great. I thought it was just like Canada wide. You know what? We can put it to see how we can take this.
okay, yeah. So
Yeah.
almost 10 years.
Crazy. But yeah.
Oh, do you have a